In this session, we will be learning more about nursing care, the oral care, NGT feeding and catheter care. This presentation has been prepared by Dr. Pooja Sadana, Associate Professor, Department of Community Medicine, SGRD Medical College, Amritsar, and she is Assistant Vice President of Punjab Chapter of National Association of Palliative Care for Ayush and Integrative Medicine. The learning objectives are identifying the common oral problems and their causative factors in the terminally ill patients, management of oral problems with locally available things, educate the patient and family about nasogastric feeding, and educate patient and family about the catheter care. Oral health is essential for carrying out activities of daily living such as communication, eating, speaking and swallowing. The oral complications that can arise in terminally ill patients can impact quality of life and contribute to functional decline and failure to thrive. 90% of the patients who need palliative care have oral problems. Factors contributing to oral problems: dry mouth, xerostomia caused by drugs, mouth breathing and oxygen therapy, dehydration, reduced intake of food and fluids, poor oral hygiene due to weakness, fatigue and debility, chemotherapy and radiotherapy induced toxicity, head or neck cancers, pre-existing poor dental hygiene, secondary bacterial and fungal infections also predispose to or aggravate oral problems. Oral problems can affect the self-esteem, ability to communicate, ability to socialize, ability to enjoy food and drinks, comfort and can cause pain also. Poor dental hygiene can result in tooth decay and tooth loss, gingivitis, periodontitis, bad breath, halitosis, fungal infection and gum diseases. Common oral problems are oral thrush or candidiasis, dry mouth, xerostomia, sore mouth, stomatitis, foul odor, halitosis, trismus, dribbling or drooling. Oral candidiasis or oral thrush, the causes may be poor nutrition, dry mouth, diet, dehydration, diabetes, smoking and antibiotics. So, treatment: nystatin liquid 1 to 2 ml 4 hourly, clotrimazole mouth paint, gentian violet and mycostatin lozenges, but do consult the doctor before any medication. Oral candidiasis or oral thrush, management of chronic candidiasis: 4-amphotericin B, fluconazole 150 milligram tablets for 7 to 14 days. Home remedies may be garlic, honey, coconut scraping, table salt, ice cream, clove and betel leaves. Remember, for medication do consult the doctor. Dry mouth or xerostomia, drugs may be anticholinergics, bronchodilators, narcotic analgesic, diuretics, antihypertensives, antipsychotics, antiemetics, antidepressants and anxiolytics. So, they may lead to dry mouth. Radiotherapy to the head and neck can again cause dry mouth. Chemotherapy may lead to dry mouth. Surgical removal of salivary glands may be important. Dehydration, oxygen therapy, anxiety, fever and candidiasis can also be responsible for dry mouth. Management of xerostomia: treat the underlying causes. Causative drugs should be stopped if possible. Artificial saliva can be taken. Avoid tobacco and alcohol. Home remedies are frequent sips of water, sucking ice cubes, cut and frozen pineapple, chewing gums, sugarless candies with help stimulate saliva, mouth rinses of 0.9% saline, 1 teaspoon of baking soda and 1 teaspoon of salt are added in a glass of water, which makes a good saliva substitute. Application of ghee, butter, margarine, swishing vegetable oil around the mouth 3 to 4 times a day. Stomatitis or sore mouth: it is painful, inflammatory, infective, infiltrative and ulcerative condition infecting the mucous membranes lining the mouth. So, we commonly get it at any point of time. Areas of asymptomatic redness and erythema, and this results in dysphagia and decreased oral intake. World Health Organization's oral toxicity scale. Now, in grade 1 there is soreness or arrhythmia. Then these arrhythmia may lead to ulcers. Patient can swallow solid food in grade 2. In grade 3, ulcers with extensive arrhythmia, patient cannot swallow food in this case. And in grade 4, mucositis to the extent that alimentation is not possible at all. So, we can see even the tongue, it has spread. Causes of stomatitis: chemotherapy, radiotherapy, loose fitting dental prosthetics, trauma, poor dental hygiene, smoking, hematologic malignancies, infection which could be viral, fungal and bacterial in nature, dehydration, medications, alcohol as well as poor nutrition. Management of stomatitis: general measures: good oral hygiene, avoid food that would aggravate burning sensation, frequent swips of water, ice chips help to soothe the mouth and give a cooling effect, application of petroleum jelly and vegetable oil, avoid smoking and alcohol, and chewing pineapple chunks. Management of stomatitis: local anesthetics, xylocaine jelly 2% or 4%, viscous, choline salicylate gel, sucralfate and silver nitrate. In homemade mouthwash, Sudarshana oral mix is there. So, in case of medical interventions, please do consult a competent doctor. Halitosis or bad breath: it is unpleasant and foul smelling breath from the oral cavity. The causes can be oral causes, which may be poor dental hygiene, dental caries, gingivitis, malignant ulcers and growths. There may be severe infections and necrosis along with sepsis of oral and nasal passages. It could be because of sinusitis, malignant growths in sinuses. It could be due to suppurative lung disease. Management of halitosis. General management is brush teeth and gums, use of floss between the teeth, clean tongue regularly, eat healthy balanced diet and avoid smoking. Specific metronidazole gargle and systemic course of metronidazole, use of soft soaked in curds and swished in the oral cavity for few minutes. Abnormal taste. The cause could be local disease of the mouth and tongue caused by cancer. It could be because of local surgery too, malnutrition, radiotherapy, drugs and infections. Poor dental hygiene. It may be due to candidiasis or smoking. Management of abnormal taste. Improve mouth care and dental hygiene. Treat oral candidiasis. Diet modification. Include more fruits in diet and drink more water. Use of pickles, salt, lemon juice, vinegar to overcome poor taste. To add or reduce sugar as per the patient's wish. To reduce eggs or dairy products. Use of cold or warm food as per the patient's wish. Sialorrhoea, excessive drooling. It is common in neurodegenerative disorders such as motor neuron disease, Parkinson's disease and multiple sclerosis. The cause is usually impaired swallowing of saliva rather than excessive saliva production. Management of Sialorrhoea. Consider regular positional changes by carers or nursing staff with advice from a physiotherapist whenever necessary. Glycopyrronium bromide as oral solution, 200 micrograms every 8 hours, titrated according to the response and tolerability to 1 milligram every 8 hours. Hyoscine hydrobromide 1 milligram every 72 hour transdermal patch. If necessary, use 2 patches concurrently. Oral doses 300 microgram up to 3 times daily. Amitriptyline 10 to 25 milligrams at night. Atropine 1% eye drop may also be used. 4 drops on the tongue sublingually every 4 hours are required. Again, do consult a medical practitioner before using any of these. Maintenance of oral hygiene, finger brush and motorized brush. Mouth rinses, chlorhexidine, povidone iodine, hydrogen peroxide which is diluted for candidal infections. Maintenance of oral hygiene, exercise, use of ice cream sticks to widen the mouth opening, use of cloths clip to gradually widen it up, oral morphine rinse 5 milligram every 15 ml, strength every 2 hours. Procedure for oral care in terminally ill, explain the procedure to the patient, provide privacy, semi-Fowler's position and head turned towards the side, place a small Macintosh with a paste towel under the head, use a padded tongue blade to open the patient mouth and separate the upper and lower teeth, soak cotton balls in solution and squeeze out excess by using artery forceps. Procedure for oral care in terminally ill continued. Clean teeth from incisors to molars using up and down movements from gums to crown. Clean oral cavity from proximal to distal using 1 cotton ball for each stroke. Lubricate lips using swab stick. Nasogastric feeding. A narrow feeding tube is placed through your nose down to the stomach Benefits of nasogastric tube feeding: it provides with fluids and nutrition to the body, fulfilling the needs of the patient when he is unable to eat or drink adequate amounts. This may be because of swallowing problems or a poor appetite. Catheter care: use of correct size catheter, Foley's catheter changed every 3 to 4 weeks, silicone catheter changed only once every 3 months. The ideal volume of sterile water to be used to inflate the bulb is 5 to 10 ml. Daily cleaning of catheter with soap and water or betadine. Increase intake of fluid 2 to 3 liters per day. Urobag should be kept below the waist level and keep the urobag cap always closed. Remember, nasogastric and catheter care shall be done by an expert nurse. Wash hands before and after catheter care. Clean the perineal area with soap and water, especially around the meatus, twice a day and after each bowel movement. Patient maintains a generous fluid intake. This helps prevent infection and irrigates the catheter. Record the patient's intake and output and note the volume and character of the urine. Report any signs of infection promptly. These include a burning sensation and irritation at the meatus, cloudy urine, a strong odor to the urine and elevated temperature and chills. Ignoring the issues of terminally ill can lead to a spectrum of problems: physical, psychological, social and spiritual. These often have an adverse effect on the patient's quality of life and dignity, where palliative care tries to improve the quality of life and dignity to the patient. Together, we can give you a smile which you deserve. Thank you.